There's no reason to be walking around with a mask.
I am speechless. I am without speech.
There's a lot of confusion among people and misinformation surrounding face masks. Can you discuss that?
There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face. When you think masks, you should think of healthcare providers needing them and people who are ill. I would urge the leaders, the local political and other leaders in states and cities and towns to be as forceful as possible in getting your citizenry to wear masks. Masks are important.
Are you nuts?
A lot of folks are hearing now about double masking, wearing 2 masks or trying to get one of those N95 medical grade masks. Do you believe that that's
You know, it likely does, because, I mean, this is a physical covering to prevent droplets and virus to get in. So if you have a physical covering with one layer, you put another layer on, it just makes common sense that it likely would be more effective. And that's the reason why you see people either double masking or doing a version of an N95.
There is no specific evidence to suggest that the wearing of masks by the mass population has any particular benefit. In fact, there's some evidence to suggest the opposite in the misuse or wearing a mask properly or fitting it properly or taking it off and all the other risks that are otherwise associated with that.
WHO advises that governments should encourage the general public to wear masks.
One of the things they shouldn't be doing, the general public, is going out and buying masks. It actually does not help. It's not been proven to be effective in preventing spread of coronavirus amongst the general public. And the most important thing I would say to people is, if you do go out to a gathering or in public, please wear a face covering. As we talk about 4th of July and independence, it's important to understand that if we all wear these, we will actually have more independence.
What?
There just isn't evidence that everyone wearing masks will prevent the transmission of coronavirus in our communities. The recommendation is that people who are ill should be wearing masks, and certainly healthcare workers should be wearing masks. But everyday people, the recommendation is not that everyone should be going around wearing masks.
The guidance now that everybody should know is to wear a mask when in public.
What you talking about, doctor?
The science is clear. Everyone needs to be wearing a mask when they are in public or when they are in their own home, but with people who do not live in their household. This is especially true with our ongoing concern about new variants spreading in the United States. Masks offer 2 kinds of protection. When I wear a mask, it protects you and it protects me. But to get the most protection possible, we all have to wear them. Research has demonstrated that COVID-19 infections and deaths have decreased when policies that require everyone to wear a mask have been implemented. So with cases, hospitalizations, and deaths still very high, now is not the time to roll back mask requirements.
When I first started at CDC about 2 months ago, I made a promise to you. I would tell you the truth, even if it was not the news we wanted to hear. Now is one of those times when I have to share the truth, and I have to hope and trust you will listen. I'm going to pause here I'm going to lose the script, and I'm going to reflect on the recurring feeling I have of impending doom.
But if people are getting vaccinated, but they still have to wear masks, they're outside in the fresh air and the warm weather, but the CDC is still saying, well, you should probably wear your mask. What's the incentive? I mean, isn't part of this sort of a reward thing where do the right thing and you'll be rewarded? Do you balance that at all when you're making these decisions about the guidance that you get?
You know, this is a question that we're looking at. One of the things I think that's really important to understand is while there's wonderful news and we're getting more and more people vaccinated every single day, we still had 57,000 cases of COVID yesterday. We still had 733 deaths. And so while we are really trying to scale up vaccination, we have this complex message that we still have hotspots in this country. And we will be looking at the outdoor masking question. But it's also in the context of the fact that we still have people who are dying of COVID.
1 week later.
Generally, for vaccinated people, outdoor activities without a mask are safe. Although these vaccines are extremely effective, we know that the virus spreads very well indoors. Until more people are vaccinated, and while we still have more than 50,000 cases a day, mask use indoors will provide extra protection.
So we've been talking about the tremendously lower likelihood of actually spreading a virus outdoors versus indoors for months. I mean, going back to last year. I think this is incentive to try and tell people, like, okay, now that we know these vaccines can save your life, here's what you get to do with that life.
2 weeks later.
Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing.
I am speechless. I am without speech.
They are trying to tout these new guidelines as a reason to get vaccinated.